webinar. All right, my apologies. And it's chilly there in Maine. Hey, we got another Mainer here. That's cool. Very cool. My name is Jen Wisdahl. I'm the COO here at FASD United, and I love policy. I'm learning so much about it, and really love what it can do for people living with FASD. This is how we can affect broad scale change. My partner in crime on the policy front is Susan Shepard Carlson, who is also now the board chair of FASD United, which I'm very happy to have her leading the board there and continuing her championing of everything FASD policy related. I'm joined also by my colleagues, Tom Donaldson, CEO of FASD United, Susan Ellsworth, our director of our affiliate program, and Chris Melfi, jack of all trades and right hand to many, our office associate who is the friendly voice that answers the phone when you call FASD United. So imagine that you call an organization and a live person picks up the phone. I know, it's a thing. Who knew? So I want to welcome you to the April 2023 Policy Forum. We've got a lot to go over, and we're kind of going to get in deep to some sides of policy that we don't normally get into today. But before we get started, I just want to give some quick updates. Tom, I don't know if you have anything that you'd like to talk about from an organizational perspective.
I'll say a couple of things, but I really want to get on to the presentation here with you and Susan have, because I know it's a lot of great stuff. I heard you say, Jen, that there's some new people, and that's always exciting. And because of that, I always like to mention the weekly roundup that comes out every Monday, the e-newsletter. Make sure you get that. Go to the website. You can sign up if you don't. And the social media. That's really a way to keep up with the sort of daily goings on. We have a great colleague, Cassidy, who does great social media for us, so follow that. Also, the Navigator is expanding. I think you all know the Navigator program, how successful that's been. That's expanding. So listen to or check out on the website what Heather and the team are up to. As Jen mentioned, the sort of expansion of non-legislative policy projects, all so important to really, ultimately to change the course of FASD to make sure that it's properly recognized and people are eligible for benefits and so forth. So you'll hear a lot of that today, in addition, of course, to the very critical updates on the FASD Respect Act. I also wanted to say that I think you all know, or if you don't, we have a project through the Department of Defense that's investigating FASD in the military health system. And all I'll say about that today, which I think is such an important point, is, the FASD United team has done important work there. I would say is to shift and to ensure that project is not just looking at prenatal alcohol exposures, but looking at FASD, looking at identifying FASD and supporting those individuals who are affected. That is such a priority, always has been, but especially over the last couple of years. So you're going to hear a lot about 4 or 5 years, but that's a critical area. So Jen, well, and I think maybe even Susan Ellsworth from the standpoint of the affiliate network probably has a word or two, but looking forward to a great meeting.
Well, just a reminder, we've got Advocacy Week coming up in September. This goes along with our affiliate summit. However, there are some things going on that you do not need to be an affiliate to participate in. We have a national research briefing where we're bringing in researchers from across the country to talk about the latest and greatest, like what's happened this last year that is really going to push where we're moving things in the world of FASD. We have a National Hill Day. come up and join us on Capitol Hill, and we will walk you through going to your legislators and meeting with them and talking to them about why FASD is a priority and why we deserve a seat at the table. You know, why we need some consideration legislatively for FASD. In addition, we've got our Red Shoes Gala happening, which is celebrating 50 years since the first diagnosis of FASD. Imagine that, FASD in the United States is as old as I am. So there we go. The times and start and stop of Advocacy Week, Kathy, you were asking. That is September 18th through the 21st. There's an affiliate day, and Susan can kind of fill us in more on the schedule, starting on the Monday, starting at 9 a.m. And then Hill Day will run through until Thursday at the end of whenever the meetings are done. There's a question about how do you become involved in the national research briefing. If you go to our website, and I'll actually throw a link in the chat, anybody is welcome to attend that. Everybody is welcome to attend that. So it's not just intended for researchers, it's intended for anybody who is interested in attending. So if you'd like to receive more information on that, I'll go ahead and throw a link in the chat, and you can sign up and get updates. So then I will pass it over to Susan for any affiliate updates that we have.
Thanks, Jen. I think you and Tom did a really great job giving the brief updates that we would have given about the summit and the starting. I just want to give a shout out to our affiliate network for what they're able to accomplish across the country. You're going to hear a lot from Carl coming up, and he's one of our fabulous affiliates. And the affiliate network is made up of autonomous groups all across the country with different focuses that are impacting change for our FASD families and our friends. And with regard to the summit, a super shout out to our group, our subcommittee that is working on diversity and inclusion and making sure that the people that we're providing services to are receiving the services in the way that benefit them the best. And with that, I'll let you get started with your presentation today, Jen.
Awesome. Thanks, Susan. All right. So for those of you that are new, we have a bill that's in the works. The FASD Respect Act, we're calling it 2.0 because it is an iteration of the bill that was introduced last year. It's based on agreed upon language in the Senate Help Committee, containing a standard case definition and funding for supports and services across agencies and then throughout states. So it's taking a 64-page bill from last year and slimming it down, but keeping the original intent, which is to push funding to states to be able to build programming that will support people living with FASD. So I know we went over it kind of in more detail last month, and the recording for last month's policy forum is up on the website. You're welcome to go back and check it out. And if you have any specific questions on the bill, feel free to shoot me an email, ask. Odds are if you have a question, somebody else probably has that same exact question. So it's always a good reminder to me that, hey, maybe I haven't done a good enough job explaining something or fleshing something out if somebody asks me a question about it. So I really, excuse me, appreciate when folks email me and ask me questions. Status of the bill, unfortunately, we haven't had a huge shift from last month. We are still in a bit of a holding pattern. We did get a message back from Senator Klobuchar's staff asking us to set up some specific meetings. So our lead authors on the bill are Senator Murkowski and Klobuchar. They were our lead authors in the Senate last year. And then lead authors in the House are Representative McCollum and Representative Bacon. And Representative Bacon is new to the bill because our lead author from the great state of Alaska passed away last year. So we needed a new co-author, and Representative Bacon stepped right up to do that, and we really appreciate it. So I encourage you, if you'd like to go look at a draft of the draft text of the bill, please feel free to. We are really hoping we'll get a bill introduced in May. This is what we're pushing on and working towards, but it happens when it happens. We can't tell them, we'd like our bill introduced now, please and thank you, do that. It doesn't work that way, unfortunately. Otherwise, it probably would have been introduced in January. But we are keeping on top of them. And just an overview again of how the bill makes its way through to law. This is where we're at. We are at the point where it's being looked at by legal counsel, and it needs to be introduced and assigned a bill number. So we've got 2 years to get this done. And again, I'm quite confident that it's not going to take that long, but you know, this is where we're at. And at almost every policy forum, I'm going to show you this roadmap and show you exactly where we are and where we need to go. So, and my apologies if I'm breezing through this, but again, I know this is a review for a lot of you. So what do we do right now? We have been asked to set up some targeted meetings on the Hill. So Susan Carlson and I are both going to DC the week of May 8th through 12th, and we will be having those targeted meetings in person on the Hill as opposed to over Zoom. Additionally, those targeted meetings, we would like to have them with constituents over Zoom. So we want to be hitting them with the twofer, in person and then also over Zoom with constituents. So what we will do in those states and areas where we've been asked to target and hit the legislators, predominantly on the HELP committee, leadership roles. We will reach out to the constituents in those states. We will set up the meeting, invite any constituents that are in that district, in that state. If you're an organization that works in that state, obviously we'll connect with you too. We want to be as inclusive as possible, and we'll put those invitations out there on the Facebook page as well. Just please, if you are not part of that state, we're going to ask you to kind of step to the back and let the people who are part of that state or part of that district take place in those meetings just to start with. But that's kind of the beginning piece. So there's a question in the chat about going to the Massachusetts State House on Friday. Where can you find bills? Those would be state legislation. So what we're referring to here is federal. But for state legislation, I believe there are a couple bills in Massachusetts. One is talking about removing punitive measures for women who drink during pregnancy, because that's been shown to create better outcomes for the child if the woman isn't hiding from CPS if she's drinking during pregnancy. So there is a bill there. I highly recommend looking at billtrack50.com and just typing in fetal alcohol spectrum, and it'll pull up a list of all the state bills that are currently introduced that have anything to do with fetal alcohol spectrum disorders. Additionally, I have a list at the end, towards a little later on in the presentation, of state legislation that we're currently watching. And there are a couple of them in some states where they're making the language more punitive towards biological parents of people who are born with an FASD, and in other states where they're making them less punitive towards biological parents of people who are diagnosed with an FASD. So we're seeing a shift there in both directions. So we will definitely keep you updated in terms of these targeted Hill meetings, though, that we're being requested to do. So state updates, as promised, because there is a lot going on in the states. It's not just on a federal level, and a lot of really exciting things happening in the states. Some bills we're watching specifically. There, like I said, there are a number of states that are doing the punitive, non-punitive shuffle in terms of child welfare law, and we'll address that at a future policy forum. But states that are working on other things right now, bills we're watching and we're hopeful, may make it across the finish line this legislative session. And each state's legislative session is different. It's all unique to that state. It all, how they refer to things in their state are different. You have to kind of almost learn each state individually, but these are some of the ones that we're just kind of keeping an eye on, to see how those go and see if those are things that could be replicated in other states. So I'll leave that for a minute because I can see a lot of you looking up at the screen and then looking down and writing notes and looking up at the screen and looking down and writing notes. Again, we will share all of these slides as well at the end of the presentation. So don't feel as though you have to take my words down verbatim, because we'll have it available for you. Bills that passed this month. This is super exciting. Hawaii, congratulations. They have had September designated as FASD Awareness Month. And this is different than getting a state proclamation. This is actually getting it codified. So this is in code that September is FASD Awareness Month in the state of Hawaii. It's not a certificate to hang on the wall. It is legislatively mandated that they recognize this. And so I want to give a big round of applause to the advocates from Hawaii. Great job on that. Washington State, they kind of hid the fetal alcohol language under prenatal substance exposure, but make no mistake, this bill was exactly about FASD. And it's providing funding for support groups, providing funding for replication and expansion of services like the Families Moving Forward program, and supports for, this is predominantly for youth up to age 13 with an FASD. And I know absolutely that FASD does not end at age 13. I know absolutely that adults with FASD are so overlooked. However, I think we need to celebrate our victories where we get them too. And, if we can get some early intervention for people with FASD, that is not a bad thing. It can't work alone, and we need more for the adults, but I think it's definitely something to celebrate. Last but certainly not least, I would like to introduce the Children Are Really Loud Act, or the Carl Act from the great state of North Dakota, and introduce my dear friend, the introvert from North Dakota, Carl Young, who is one of our affiliates and quite a lobbyist and advocate in his own right, to talk about what they got done in North Dakota.
Yes, I am the tremendous introvert, fabulous, all of those wonderful adjectives. It has been, we're waiting on the governor's signature, but that's a formality at this point. He is fully intending to sign our bill. So the initial legislation included 5 pieces, the something for individual education plans, a training component, and a I forget, add the FASD to the state definition of developmental disability, and then recognize September 9th, not the whole month, just September 9th, as FASD Awareness Day. We're going to do a proclamation for the whole month and just recognize the whole month, but we want to get it codified that September 9th specifically is FASD Awareness Day in North Dakota, and that is passed. In addition, our bill got pared down to the definition and the day of awareness. Moved the FASD task force that we asked for to something called the Cross Disabilities Council and passed that. So we're going to be a part of a disability council that addresses things like autism, FASD, Down syndrome, and all of these other disabilities that are in the state of North Dakota. In addition, we were able to successfully lobby for something called the Family Caregiver Act that will help pay families to take care of their developmentally disabled children. So if mom or dad has to quit a job to stay home with the kids, they can get a small salary from the state of North Dakota to help them with that. In addition, yesterday I met with the Department of Health and Human Services, and they said, we would like you to send us some information in a proposal form about doing lunch and learns beginning in September for fetal alcohol spectrum disorders, and tailor one session to foster families and one session to child welfare workers. But it'll be ongoing because we know that not everybody will be able to reach each session or the only session that's offered. So, and we found a funding stream that will give us a grant to pay for that. So it won't cost the Department of Health and Human Services a penny. So all told, people are like, so how much effort, what's involved in all of this? Our team has over 700 hours of legislative advocacy this session alone. And our session ends May 8th. So, and before anybody asks, our team is one person. So, yeah, it's been a phenomenal year. We had some disappointments because we thought we lost parts of our bill, and they turned up in other legislation, and just got shuffled around. By and large, I would consider this a huge monumental success. The nice thing about all of this is just the start. We have another session coming up in 2 years, and we're going to start all over again and ask for funding next time and hope that we get it, because right now they don't want to spend any money. So we want to offer all these wonderful things to support this community, but we don't want to have to pay for it. So we're going to be able to come back with a dollar amount of what it's going to cost per family, per child, and move forward from there. But we had to start somewhere. And I'm told that this is the most significant legislation for fetal alcohol ever in the state of North Dakota. That made it this far to the governor's desk. So everything else has been killed in committee. So yes. Yeah, it's been quite phenomenal. I know of a number of other lobbyist advocate people who've said that they've never experienced anybody coming in with their first year of legislation and getting it passed. Most people have to take 2 and 3 sessions to get through what we did in one. And we started it long before session started. So yes, we're documenting our steps. So, we'll figure out some way to do classes on it. I don't know that everybody keeps calling me the expert, and maybe I am, but I think a lot of it was luck and being in the right places at the right time to talk to the right people. So, and some of that is simply eating lunch in the Capitol cafeteria where the legislators come every day and inviting them to sit down and have lunch with me. Yes, persistence. You have to be persistent. If you quit the first time somebody says no, you're never going to be successful. Not with this. So, yes. Anyway, that's it in a nutshell. And for those that are wondering, my wife had back surgery on Friday. They both broke her back in 4 places, and she gets to come home this afternoon. So, yes, she's doing very well. No, I don't buy lunch. I have not spent a dime on anything, lobbying activities. Everything has been word of mouth. Somebody asked a question in chat, am I buying their lunches? No. And the reason for that is because they pass themselves a lunch increase so that their lunches are paid for by the state of North Dakota. They don't need me to buy their lunches for them. They get more than enough money for that. So anyway, if anybody has any questions, you can shoot me an email. We can chat on Facebook, whatever you want to do. I'm more than happy to talk. I've talked to Kansas and North Carolina on Zoom already, and I'm happy to help anybody that wants to work on legislation. Next.
Carl, that's amazing.
And yes, I do consider myself an introvert. Yeah, I don't generally like talking in front of large groups of people, even though I used to be a college professor. But yeah, I do consider myself an introvert, and most people around close to me would say the same thing. How I did this, I have no idea. So, anyway, oh, the other thing too is our snow is gone.
Yay.
Yeah. Anyway, that's all I have.
That's all. Yeah, just that little tiny bit.
Just that little tiny bit. Yeah, right. So it's been a phenomenal year. That's all I can say. And the year's not over yet. Now, if we could get all of this to apply at the federal level, I would be ecstatic. So baby steps. We'll get there.
We'll get there.
Yeah.
Thank you, Carl. I really appreciate you giving a rundown and documenting your steps and offering to support others. And you know, this is how we do it. It is those baby steps. It is those connections that we're building. It is that persistence. It's showing up. It's being present. You know, it's those little steps that we take. And, you know, Susan and I were talking earlier today about the legacy we leave and what legacy do we want to leave. And what a great legacy to leave for people with FASD in your state, Carl.
Yes. Well, we're going to start working on Montana next because we did open a satellite thing in our clinic or satellite office in Montana, which the number is available at with the Family Navigator. So, and yeah, our next goal is Montana. So. Yeah.
Fantastic.
I think it shows how what one person can do. So I
tenacity.
Think yep. Tenacity, persistence. Just
our office is in Miles City. That's actually more of a PO box than an office, but it's there. Yeah. So, but yeah, it's the biggest thing I could tell anybody about doing this work is that if you need to take mental health time a day or a week, don't hesitate to do that. Because if you don't take care of yourself, you're not going to be at all successful in the endeavor of trying to get somebody to vote your way on a bill. So I took a whole week off right after Easter, and that was the best thing I could do. And yeah, don't hesitate to take time off and say, hey, you know, my brain needs it's fried, I need a break. And make sure you're taking care of yourself during this process, because it will suck the life force out of you.
Yeah.
Live long and prosper.
Excellent. Thank you, Carl. All right. So we are going to shift gears ever so slightly and talk about another project that's policy related that we're currently working on, state report cards. And this is not, oh my gosh, you are doing such a terrible job in your state of promoting FASD. This is not to judge that in any way, shape, or form or to imply that. This is looking at the lay of the land legislatively in each state and figuring out where things are being done well that could be replicated and where things are being done in a way that really doesn't serve the FASD population well. So, you know, some of the measurements we're looking at are, you know, education, support availability, is the legislation friendly or unfriendly to people with FASD and what we know from research. And then a big one is eligibility for disability services. And I want to thank our affiliate, one of our affiliates from New York, JFO, for posing some questions that really kind of got us working on this about eligibility for disability services. And so I will turn it over to Susan Carlson. Now, I am going to warn you, these next few slides, they're very wordy. I'm also going to give a trigger warning. I thought I had a slide in here that mentioned this, but there are the words mental retardation or retardation used on some of these slides. FASD United does in no way, shape, or form condone or accept the usage of those words. The words are in here in historical context only, because that's what was printed at the time. So I just want to give that caveat. These slides have a ton of information on them. We will be providing this to you as a Word document as well, because we recognize that these are, excuse me, kind of hard to read the way they are. So just be aware. And then Sid had a question in the excuse me, in the chat about will the report card track plans of safe care reporting of FASD and alcohol exposure? And yes, Sid, that is one of the areas that we did want to measure. Absolutely.
Okay. And Jen asked if she got these questions, and the questions, this was the first one. And I think she should know better than to give a lawyer the assignment, because, you know, they were simple questions, but once you get into it, it really becomes awfully complicated and complex. And then you can begin to understand why families, you know, and we're just talking about developmental disability services here. This has nothing to do with education services. This is just developmentally DDA services.
Waiver services, as they're called in some states, because each state has a different way of referring to them.
Yeah, CADI waiver, Medicaid waiver. So, but one of the first was, why is FASD not recognized as a development disability on the federal level? And I think, you know, as I looked at it, you had to look at it historically. And because you would think, you know, that we've learned that, you know, these services could be very well suited. And one of the things we learned as we met with parents the last 2 years on the RESPECT Act is that there is a lot of services like respite care, home services that could be adapted for families, and probably do for those families that where there's, you know, that they go through this process, and it's just but there's no definition, there's no thing that recognizes FASD. And so and it's really a complex system. You've got the federal law, and then there's there's federal regulations, and then there's state laws and state regulations that dictate this. And every one is, well, they vary. And so we'll get into a little bit about that. But we'll go to the next slide, Jen. I can't remember what we, okay, so on waiver services, and this is Medicaid waiver services. And so I just giving a little history.
And sorry, I put this in the wrong spot. That's my fault.
We did this about a half an hour before the, you know, we've got a
yeah. So this is the second half of that the answer to that question.
Yeah. So one of the reasons, and I think this is also probably true with autism spectrum disorder, is that functioning within the spectrum varies widely, and there are some that in the spectrum that can attain full employment and raise a family without services, and there's others that need residential placements and services. And as we begin to look at the history, this was for those with intellectual disabilities. And only about 25% of our population actually have an IQ of less than 70. But then there's a lot of, as we know, a lot that struggle with executive functioning and skills and all of those things that make it difficult. So how is that captured with DD services? And so let's look a little bit on the history. And if Jen had had a lot more time, she would have made all the slides pretty. Oh, she did. Okay, so we had the first act was in 1971, and that was as an optional service under state's Medicaid program, and that was for institutional out of residential placements, and that was. And here you find, and at that time, you know, we've changed historically on the verbiage. And so that's why that's what it was, and was mental retardation. So that's why you see that. And then in 1981, that's when they first started the Medicaid waivers for alternatives to institutionalization. So if it was the same definition, but if states could do a Medicaid waiver, they would get funding to a community in the community services. So that's when it all began in 1981. And then I thought it was interesting, that last one, that because in 1981, the American Association of Mentally Retarded actually expanded the definition, and the federal government looks to that organization in defining in definitional terms. Although I haven't been able to find that that there is a definition of when it starts, but they added from conception to age 18, and then the DD Act extended that to 22. Okay. So this is the current definition. So a diagnosis of an intellectual disability, or have a condition that's a related condition, which results in impairment. And so they must meet either the intellectual disability or have a related condition when they're not diagnosed as having an intellectual disability. And we'll look at what that related condition language is. So, so this is, it's interesting. If you look at, they do actually have, and this was from the beginning when they started with categories, they had cerebral palsy and epilepsy or any other condition other than mental illness that's closely related to intellectual disability. So you don't see autism in there. You don't see FASD. So I thought it was, but as we know, there are a lot of, and we've learned, or I've learned, that there's a lot of Medicaid waiver programs in the states relating to autism. But this is what has to be met. So you can't, and I think what's it has to be those conditions. You see, before age 22, it's likely to continue indefinitely. And then you see the different function areas, and you have to meet at least 3 of those. And if you look at with a diagnosis of FASD, that report should, if it's done correctly, really look into those different areas, so so the diagnosis could be used in applying if there's a waiver. Okay, next. Okay, so I think this is really because I think as we look through, another question was, why is it difficult for families to obtain services? And I think it's because of the complexity, and all the states are different. states have a lot of discretion. And I think that's what's really important. And when you look at the federal law, they have a lot of discretion in determining the program, the eligibility criteria, the dollar amount, and it depends on, state funds. I mean, they may be really strict and have it strictly IQ, but they must, and states are advised that they have to meet the related condition if they're not going to have someone diagnosed with an intellectual disability. They're on the related conditions, they may involve some discretion on the part of the clinician or evaluator. So that's where I think it gets tough for those families with an FASD, because as we know, this is not a well-known disability. It's getting more and more well-known, but so there's some discretion on that. But note the definition does not require that an individual have an intellectual disability as long as other related conditions criteria are met. Okay, I know this is a lot and you're going to get the slides. It's a lot of information, but I wanted to. So why is it difficult? Well, and I just said that eligibility varies from state to state. There have been created in every state a state council on developmental disability, which can provide more available resources and eligibility requirements in each state. And we've started going through that. I think for this, it's going to be a real big challenge to go through every state and look at their state law and their regulations. But we'll be looking to the councils on developmental disability to get that information so we can provide that information in our report card. And I think, again, the lack of knowledge. Next. So if it's recognized in any state, which ones? Okay, so, and I ran out of time, obviously, as I was doing this, but some states use the categories. Okay, so they'll use autism, they'll use spina bifida, autism, etc. Others use the functional, so it's not by category, it's by function. But a majority of the states use a combination of the two approaches, referencing both the category and functional criteria. So now Minnesota has FASD as a related condition. So which makes it really helpful because then it's right up front and center, and it's not something that is not unknown. But they still have to meet the functional criteria that I talked about earlier. So it's not an automatic for services. You still have to meet those functional criteria. And then Jen, you put down, this was just recently adopted by Washington. The persons with FASD have an IQ of 78 instead of 70. And I have to say something about the IQ because that's, I think, a process that's kind of evolving also. And once you start down one road with this issue, it takes you to all sorts of different roads. And it was kind of driving me nuts. And then, yeah, and so in Washington, IQ will no longer be used because we're finding that IQ really, and we know this, I mean, all of us advocates know that IQ does not dictate how well somebody's going to fare in our society.
In Washington State, just to clarify, years ago, some advocates got it passed that because Washington State was a strict IQ state, and they got it added in that for FASD, there was a waiver on the IQ as long as they were under 78 as opposed to 70. And just in this last legislative session in 2022, they decided to move away from IQ being the determining factor and go into adaptive function and other functional criteria being the determining factor, but that doesn't take place until 2025. So, for example, none of my 3 kids with FASD, including the one that's dual diagnosed autistic, qualify for DD services in my state. You know, and we see that quite a bit for families with FASD. It's quite hard to get that sorted out. So, you know, this is part of the process that we're going through with these state report cards, is trying to go through and compare apples to apples. And what we're finding is we're comparing apples to radishes, because as federal legislation is passed that puts the responsibility for federal programs back into the hands of states, states are allowed to interpret things as they wish. How they interpret the federal mandates really can become a gatekeeping thing. You know, screening people out of developmental services as opposed to screening people into developmental services.
Well,
And
a lot of it gets down to dollars. You know, that's how they control the dollars, and they have huge weight on the, even the ones that have it have huge people are on the wait list for Medicaid waivers for a long time. But that's where we can do our, you know, lobbying on the Hill too for increased. Actually, there was a vote today, I think, on Medicaid waivers. But it is, I think that's a lot of times how states control costs, unfortunately.
yeah, and that is a concern that's brought up. I know it was brought up in New York, as New York's been looking at it. I know it was a consideration in Washington State when they were looking at it, is how much additional cost to the state is there going to be if they expand the definition, right? And so that's another kind of barrier, that if we want to be able to change that and have people with FASD qualify for services in a meaningful way, we're going to have to get past that barrier on a state by state basis. You know, just given the way that the House and Senate are divided right now, it's probably not likely that we would get a bill put through that would federally change how disability services are enacted for Medicaid waivers on a state basis. You know, it would be the DD equivalent to FAPE. And I don't know that we are legislatively in a place where that would fly at this point. But, you know, something to look at for the future.
But I do think that it's, and we'll get to the next slide, it's worthwhile for advocates, FASD advocates to, what is being done here? This is the right slide. So what is, like, the current definition is not categorical. So we're not going to go in and add FASD to the federal definition. It's going to have to happen in the states. And what's happened, I mean, look at autism, for example. Autism is not a category on the federal, but what the autism advocacy has done, they had the federal law, Autism Cares Act passed, and that provided a lot of resources for autism treatment. And as a result, you see a lot more activity on Medicaid waivers for states for autism. But that wasn't because they changed the definition in federal law. So I think we can learn a lesson from that, and we're doing the right thing. The RESPECT Act really is the avenue to provide funding to the states to begin to really look at this issue in their state's diagnosis services, and and they would do waivers. Now I know, and I don't know, do we have anybody from Alaska? Because I know that they did a FASD specific waiver at some point in Alaska, and it's not there anymore. So I don't know if there's other folks on that.
I'm here. This is
okay.
Terry.
Hi, Terry. Yeah.
Hi. We had a waiver. It went on for about 4 or 5 years. It was a demonstration project, and it didn't get renewed. And there were a lot of reasons for it not being renewed. There weren't that many people that were brought into the program, and I'm not a great expert on Medicaid waivers, so apologies for if my language isn't correct about that, but I remember that the situation was that it took a long time to get up and running. There were a lot of barriers, and they just didn't get very many people participating in the program. So, like I think I don't remember the number. Mike Jeffrey is on the call, he might remember, but the number was so low that it wasn't considered viable. So they just said no for renewing it. Does that help?
Yeah, I think that was very helpful. And one of the things, and I don't know, did we talk about this last time, Jen, that we're meeting, this is on, we met with a law partner of Kate Boyce's husband, who does a lot of Medicare work, and we talked about doing the work to the ICD-10 code, and then start doing some states. Once we get that, do that and start working on Medicare, Medicaid waivers in states.
Right. So to kind of contextualize that, currently, if you get a diagnosis of an FASD in the United States, it's one of 47-ish different medical billing codes. There's all these different diagnostic codes that are used for conditions on the FASD spectrum, but there's no overarching. So, for example, like Canada has, I believe they have it in Australia too. So it's really hard to look at because some of those FASD diagnostic codes are also used for other things. So it's a bit of a mess. So what we've talked about is, and it's a really specialist thing to do, is being able to get one overarching diagnostic code for FASD, because we know that in the United States, FASD is not a diagnosis. It's all these conditions under the FASD umbrella that are considered diagnoses. Can we get a code for the overarching FASD? And then if we have that, then we can approach the states to work on Medicare reimbursement and Medicaid in individual states. Because we have that one code, we're not dealing with the 47 different diagnostic codes that are used in FASD land now. So that is kind of an ongoing thing that we're looking at, working on getting funding for, working on, how would that work? How would that happen in the US, given all the other factors at play? So it's exciting to think about. That is going to be a big project to tackle, but one I think that needs to get done.
Yeah, it requires a lot of legal. There's a lot of legal hoops. He was talking up to $5 million to if you're going to do it well. So,
yeah.
Anywho, I think that's it for mine. Yep.
It is.
Yeah.
So another ongoing project that I just want to give you an update on is FASD legislation around IDEA, and because that is an area that we've talked about wanting to tackle on a federal level, but we need some ammunition to be able to back it up. We need some more data to be able to ensure that what we're doing is going to be helpful, is going to be prudent, is going to be something that we can get past. And so we have a small task force that is working on FASD in education. And it's starting with replicating a survey on FASD in education that was done, I believe, back in 2018 by some of our affiliates. And we're modernizing that and running it through the lens of educators, because I think when it was done before, it was really well done, but it didn't necessarily ask questions in the way that the education system would look at things. So we originally had hoped that the survey would be going live in April. However, we realized that some of the questions that we were asking of adults with FASD needed some work, because getting information from adults with FASD on their school experience, independent of the parent, I think is a very important and critical piece. So that needed some work, and we want to make sure that we are running this survey through educators to make sure we're asking the right questions, people involved in the education system, because we all know FASD. Many of us really know education, the educational side of it, from working with our families to, try and get our kids through school and going to the IEP meetings and, prior written notice and IEEs and all of that. But from an educational standpoint, what do we need to do to make sure our ducks are in a row or our squirrels are in a conga line, so that the teachers union doesn't oppose the bill, so that the school principals association doesn't oppose the bill? How are we making sure that we're putting this in the right context so that we can actually get something done? Because, I don't want to be introducing legislation that is just for show. If we're going to introduce legislation, I want to make sure it's something that we can actually get passed, and that will make a difference. So, excuse me. This is still a work in progress. We're going to be meeting with some other disability associations that for other disabilities to find out, how they've done things on their end with FASD or with education, specifically in their disabilities. So we're going to keep reporting back to you on this, and keeping you updated with where we're at, and may come to some of you and ask some questions as well about how FASD is handled in your state in terms of education. But just wanted to give you kind of an update on where we're at with that. So we are at the top of the hour. Happy to stay on if anybody has any questions, any comments. We will have the record, excuse me, the recording of this available up on the website in the next couple of days, as well as the slides. We'll have a PDF document that has the information that Susan presented in a document format. And then the other thing we've been trying to do is also have published an outline of the presentation today that has the links included to anything that we linked to. That way you can find those easily. So really appreciate you joining us. Our next policy forum will be Wednesday, May 31st. I'm hoping we'll have a bill introduced by then. But thank you again for joining us, and appreciate your time.
Yep. Yeah.
And Liz McHugh, you had a question about an event. What was the event presentation that was taped and shared with us at the last meeting?
Sorry, that was for Michael Jeffrey. He was talking about the Alaska thing, and on the last call he went through the thing. I was thinking of sharing the link again with the folks on the call that weren't on the last call, because it was really, really good. So I saw people asking him questions. That's all.
Oh, gotcha. That was the trailer for the FASD movie. Was that what you were talking about?
Well, they were in a group, they were in a room, and they talked, and we couldn't see the people in the room, but we could just see them. But it was linked to the Alaska, I don't know, the link was onto some Alaska Federation of something. I can't remember what it was, but anyway, I watched it, and it was I only found out about it for the meeting last month, and I thought it was really, really good. And I just was thinking if he could put the link up there again, that it would be great if other people were aware of it.
Can you describe the content of what you watched, just so I'm sure, because I could put the, well, yeah, just what was the content of what you watched? What was it?
It
You said
wasn't